So very similar to the other survey topic, this is a kind of an overwhelming slide with the number of things that we covered, but we know that the impacts of COVID-19 are pretty far reaching. And so we really wanted to be as comprehensive as possible in the topics we addressed. So on the survey, we asked about partner relationships and household dynamics, changes to employment and financial and other hardships, childcare arrangements, needs and difficulties, maternal mental health and mental health needs, which we'll look at a little bit today, changes in well childcare and immunization practices, perspectives on the COVID-19 vaccine, and blocks specifically for pregnant and postpartum people. Before we dive into the results, I do like to provide a few caveats for the data because we will be looking at only data today from the COVID-19 survey from earlier this year. And so because of the population we surveyed, the results represent parents of children ages 0 to 3 who are still living in Colorado. And so we specifically asked parents to answer questions in reference to their 0 to 3-year-old. So while many of these families might have more than one child, we cannot extrapolate the findings to the entire family or all their children. Throughout this survey, we used this cut point of March 1st, 2020 to mark the start of the pandemic. And so you'll see that date throughout the presentation as we represent that shift of pre-pandemic to post-pandemic. So for example, we capture, we ask, how would you describe your household finances now compared to before March 1st, 2020? To capture anxiety symptoms, we use the GAD-2 screener, which is a 2-question screener. And I always like to caveat that, especially with all the clinical individuals that we have on the call today, an elevated score means that it could be indicative of a possible generalized anxiety disorder, but this is not a clinical diagnosis, and we do not say that just because the score is elevated, that they have anxiety. Sorry, back one slide. So finally, our last caveat is that we are the collectors and we hold the data at CDPHE, but we are truly not the experts, you all are. And so we've done our best to contextualize the data as best as we can throughout the presentation, but we really rely on our partners and stakeholders, such as like all of you, with learned and lived experience to inform how we understand the data. So to get us started, we'll look at mental health impacts due to the pandemic, including anxiety symptoms, mental health care access, and barriers to care. But before we jump into the quantitative data, we'll take a look at some of the comments that our partners shared with some of their experiences during the pandemic. And we hope that this kind of gets us back to those lived experiences that we want to speak to with this data. So I'll give you all a moment to read these quotes and to kind of let them sink in for a moment. Next slide, please. We will make our slides available after, so if people didn't get a chance to read all of them, these will be available for you to view after the conference. So from our survey, we see that about a quarter of parents had a GAD-2 score that was indicative of a possible generalized anxiety disorder. And although 1 in 4 have that elevated score, an even greater number of parents said that they were experiencing a greater degree of anxiety in their lives. Nearly 60% of parents report that they felt more anxious than usual due to the COVID-19 pandemic. And mental health impacts can have a rippling effect on parents' ability to care for their children or be present with their spouse or partner, or exercise their own self-care and show up in their jobs, et cetera, et cetera. And so as we continue to talk through some of the mental health impacts, I'd like you to keep in mind some of those other survey topics that we included, because we know that mental health is really not an isolated topic or an isolated concern, and is often impacted by other factors or can impact other factors. We also see that 42% of parents reported needing or wanting mental health care or counseling services since March 1st, 2020. And on the right graph, we see that individuals who said that they felt more anxious since the start of the pandemic or who had elevated GAD-2 scores were significantly more likely to report needing or wanting mental health care or counseling services. But importantly, among those who said that they did not feel more anxious or did not have an elevated GAD-2 score, there was still a substantial proportion of individuals who said that they needed or wanted that care. So it's not just isolated to people who have mental health concerns. Out of all birthing parents who needed or wanted mental health care or counseling services since the start of the pandemic, 50% were unable to get the care or services that they needed or wanted. Among those who needed or wanted care, the most common reasons for not being able to get mental health care since the start of the pandemic were being concerned about cost, not being sure where to go or who to go to, and not having someone to watch their children. And I like to note that these are not barriers that are specific or unique to the pandemic. These are barriers that existed before the pandemic started and have likely just been worsened over the past year and a half. And so that's the mental health data that we'll focus on, and I'll pass it over to Erica to get us started on our next section.
Thanks, Becca. So now I'm going to transition. Sorry, I don't know if the rest of you are getting really bad feedback from my speaking, but I think it's better now. So I'm going to transition to talking about the impact of the COVID-19 pandemic on child health, as well as sharing some of the data we have on vaccine perspectives. So next slide, please. So just over half of individuals had a healthcare worker talk to them about how to access well child care since the pandemic started. And in comparison, 8 out of every 10 individuals had a healthcare worker talk to them about how to access routine vaccinations since the pandemic started. And this is important because we know that all types of healthcare changed and had to change drastically very quickly at the start of the pandemic. And we also know it's really important for healthcare workers to communicate about how to access care in situations like this. And so we really see that the importance of healthcare workers here when we see that individuals who did not have a healthcare worker talk to them about accessing routine vaccinations were significantly more likely to have delayed or skipped vaccinations due to the pandemic. So 15% of those who had a healthcare worker talk about accessing routine vaccination delayed or skipped vaccines due to the pandemic, compared to a much higher 28% of those who did not have a healthcare worker talk to them about how to access vaccinations during the pandemic. Previous slide, please. Can we go back one slide? Okay, we did not see the same relationship for well childcare, and so there wasn't a significant difference in the percent who delayed or skipped well childcare due to the pandemic, based on whether or not their healthcare worker talked about accessing well childcare. And so this might be indicative of how polarizing vaccination conversations can be and how much of an influence healthcare workers can have on these conversations. But we do know that aside from healthcare workers, there are a lot of other things that go into a parent's decision, especially around vaccinations. So we asked a few questions diving into those perspectives. Next slide. So parents were asked if they would have their child vaccinated if the COVID-19 vaccine was proven safe and effective in children. So as a reminder, this survey was administered in January and February of this year. So some perspectives may or may not have shifted by this point, especially as more of the general population has received vaccines. However, we still think it's really important to share these perspectives from earlier in the year. While 44% of parents would choose to have their children vaccinated, 36%, so a third, were unsure if they would have their child vaccinated, and 20% would not have their child vaccinated. And so we see that having a third of parents who are unsure if they would have their child vaccinated is a really large portion, and we need to understand why this hesitation exists. Next slide. So we asked parents who would get their child vaccinated to select from a list of reasons as to why. And so the four most common reasons are to help stop the spread of COVID, to protect the child, to make it safe for the child to be in school or childcare, and to protect themselves or their family. So we notice there's a wide spread of responses here, which indicates that there are a lot of reasons why parents would choose to get their child vaccinated. Next slide. So we asked parents who would not get their child vaccinated to also select from a list of reasons. Here we see the answers are slightly more skewed, so there are fewer, more specific reasons the parents would not get their child vaccinated. The top 4 reasons are mostly centered around a lack of trust in the COVID-19 vaccine, including feeling the vaccine won't have been tested enough, being worried about side effects, thinking the risks outweigh the benefits, not believing the COVID-19 vaccine is safe. And we saw similar responses among parents who were unsure about the vaccine. So they responded with some of the similar vaccine hesitancies, although there were lower percentages across all response categories. Next slide. So with the Healthy Mom surveillance system, we really like to hear from the parents and have their direct quotes. And we know that vaccines, particularly the COVID vaccine, can be a very polarizing topic for parents, especially since they have to make this decision on behalf of their kid. And so here we have a couple of quotes from parents about their thoughts on the vaccine. And I will read 2 for you. So first, it's great that we have a vaccine, but we all know this was developed fast. It should be optional, but never required, but especially not for children who are very low risk for complications from COVID-19. And then on the other perspective, I hope the COVID vaccine is added to the required vaccines needed in Colorado. As a highly contagious and relatively deadly illness, I think we need forced herd immunity in many places. For the interest of time, we can move to the next slide, and you can see the rest of the quotes on the slides online later. So we also asked parents about their opinions on vaccine mandates, and I need to caveat this section with a disclaimer that these are not the beliefs of the state health department, and these are not related to any impending mandates. We know these are difficult conversations and require a lot of nuanced discussion, so this was just an opportunity for us to open up those discussions with parents enrolled in Healthy Moms. If people feel really strongly, we'd encourage them to reach out to Rebecca or myself to discuss further. So we asked parents whether they would support a law that requires all childcare workers and teachers in Colorado to get a COVID-19 vaccine. As you can see, the results are very split. About a third either disagreed or strongly disagreed, a quarter were unsure, and 40% either agreed or strongly agreed. So it's a very split response as to whether there should be a law that requires childcare workers and teachers in Colorado to get a COVID-19 vaccine. Next slide. We also asked parents if they would support adding the COVID-19 vaccine to the list of vaccines that children are required to have in order to attend childcare and schools in Colorado. So we see the data is even more split here. And so we see that roughly a third either disagree or strongly disagree, a third are unsure, and only a third agree that the COVID-19 vaccine should be added to the list of vaccines that children are required to have. So we included specific sections on the pregnancy and birthing experiences for those who were pregnant at the time of the survey or had given birth during the pandemic. So I'm going to dive into a few of those results now. Next slide. So the results from the next couple of slides are among individuals who were pregnant at the time of the survey. So the sample size is smaller here, so do interpret the results with some caution. As we all know, the pandemic has impacted all facets of life, including how people were able to access healthcare. So among those who were pregnant at the time of the survey, about half attended in-person appointments only. More than a third attended a combination of both in-person and virtual appointments. And then there was a very small percentage, about 2%, who attended only virtual appointments, and 7% did not have any prenatal care. For those who had only in-person appointments, the most common reasons for not having virtual prenatal care was a preference for seeing their healthcare provider in person and a lack of available virtual appointments. We know there are likely discrepancies in the data, and we would love to have been able to look at this data by geographic or demographic variability, but due to the small sample size of the respondents who were pregnant at the time of the survey, we're unable to do so. Next slide, thank you. So notably, 3 out of 10 pregnant individuals had at least one canceled or delayed prenatal care appointment due to COVID. Most often, the appointments were delayed or canceled due to provider availability, where the office was either closed or had reduced hours. Respondents also reported not having anyone to take care of their children or family, concerns about being exposed to COVID while attending a healthcare visit, missing appointments due to self-isolating from a possible COVID exposure, not having health insurance through the pandemic, and worrying about the safety of public transportation during a pandemic. We also asked pregnant people about their thoughts on the vaccine. So again, this was administered in January or February, and thoughts may have changed. So among those who were currently pregnant at the time of the survey, a third would get vaccinated for COVID if they had the option. And so we have the top 5 reasons for choosing to and for choosing not to get vaccinated. And you'll notice on the left, there's a broader range of reasons for why people would get vaccinated versus why they would not on the right. So those who would choose to get vaccinated would do it mostly to protect their baby, themselves, to stop the spread of COVID, or to protect others around them. Those who choose not to get vaccinated do so as a result of concerns of safety and the side effects of the vaccine in pregnant people and a lack of having tested the vaccine. So next slide. And so we know the COVID-19 pandemic impacted pregnant people far beyond the stats we just showed you today. So we're going to end this section with a few quotes from respondents about how COVID impacted their delivery experiences. So first, it was impossible to get a lactation consult in the hospital. It ultimately forced us to formula feed. There was a lot of stress when we were ready to give birth with the thought that my spouse may not have been allowed in the room with me. It didn't end up happening, but it was incredibly stressful unnecessarily. All right, and now I'll pass it back to Rebecca to finish us off.
Wouldn't be a virtual conference unless I forgot to unmute at some point. But before we open up for comments and reflections, I do want to take a moment to highlight some of the comments that we've received from parents who take the surveys. Some of you in the audience may know that recently our CDPHE has made the decision to slowly shut down the Healthy Moms program due to unstable funding. But we are continuing to collect data on our currently enrolled cohorts through January of 2022. And when we commit to continuing with data collection, we're making a promise to the families who trust us with these experiences that we've shared with you today. And we're promising to use this data to represent their experiences and figure out how to support them and families like them. And so we are committed through sharing these findings to audiences like this, to elevating our participants' voices, and getting these data into the hands of those who can use and inform and affect change around the state. And so we hope we've taken another step in that direction today by sharing these data with you and raising some awareness around the impacts of the COVID-19 pandemic and issues that families are facing right now. But we know that there's a lot more that we can do. And so even as Healthy Moms starts to wind down, we know that we have so much rich data to offer and that can hopefully help families across the state. And we're going to continue to have more data over the next 6 months. So we will continue to do our part to disseminate these findings and fulfill this promise that we made to these families who have taken the time to share their experiences with us. And so with that, I'd love to open up for some reflections, thoughts, comments, questions, and we appreciate all the time today. Thank you for having us.
Thank you, Rebecca and Erica. I'm always amazed at what the data tells us. And like you mentioned so clearly, connecting the stories and the experiences with the data is critical in the work that we do. I want to make a plug as well for a specific piece of the data that you didn't share here today, but it's regarding behavioral health. And our team is going to upload the perinatal behavioral health report. It was the first of its kind that was released earlier. We'll upload that to the WOVA app so folks can access that. It's certainly relevant to the next session as well on our behavioral health panel. But tons of great information and really informative data that we can use. And then questions are coming through, and one is, how is the data and how are the comments used and how can we access them?
So I can put this in the chat. All of our data is currently available online in tables, although I would definitely encourage you to reach out to us personally. And Megan, if you flip through 2 more slides, I think my contact information will show up. Just because there's a lot of data that we have, and so it can sometimes be hard to sift through. But we try to disseminate it as much as possible and through as many avenues as possible. So the postpartum behavioral health report that we published, we present at a lot of conferences such as this, and informally to external partners as well as internal partners at the department. And we are always open to continue our new collaborations because we really strongly feel like this data is important and should be shared as widely as possible in an accessible way.
I agree, and thank you. And yes, some examples of that is, speaking to policy and finance groups and really trying to leverage the information that is here to help us advocate for certain things, like we mentioned earlier in the day, first thing in the morning, the Medicaid expansion in coverage, and being able to really see what's happening longitudinally with families and how that impacts their outcomes. There's also a question that came in about data specific to post-vaccination availability and opinions regarding mandates. So do you have a sense of when new data, additional data would be available regarding the COVID vaccine specifically?
So we have recently, PRAMS has a new supplement that they added that was specifically looking at information around the COVID-19 vaccine. And because we have Healthy Moms, we were fortunate to be able to field it on that survey. And I'm trying to remember exactly which survey we put that on. I want to say we won't have data on that until at the beginning of 2022. And unfortunately, because the COVID-19 survey was a one-off survey, we don't have a plan to have a follow-up on those exact same questions. And so we won't, or at least in our current plan, we don't have exact follow-up data on the data you saw today.
Thank you. Right, we have just another minute or so for any last questions. And as Rebecca mentioned, contact information is there on the slide. And again, you will get copies of slides, the recordings, all the links to the documents and the information in the WOVA app. So don't forget to go there to reference these amazing resources. And again, want to just really thank Rebecca and Erica. You've been such amazing partners throughout our work at CPCQC, really helping to inform us, of what priorities there are in the state in perinatal health and potential areas of focus where we can lend resources to really address those needs. And so thank you for the partnership and the really informative data. This was just a snippet. So for those of you on the line, I would urge you to check out that link that was shared in the chat, where you can find much more detailed, robust data.